Here to talk to you about opiate abuse, opiate use disorder. And this is near and dear to my own heart as one of my drugs of choice back in the day. And why we need to use a holistic non-12-step process to move beyond symptom management, move beyond the idea that I'm just an addict and this is what addicts do, that I can get to the underlying reasons why I would go and destroy my life. So nobody starts an opiate addiction knowing where it's going to go. Many times people are prescribed, and that's what happened to me. I was prescribed some opiates, and next thing I know, I have a substantial opiate habit going. So it creeps in, and a lot of times we don't even know that that's happening, because sometimes these things are for pain management, and it turns out that long-term opiate use is a terrible strategy for pain management. And so what we do at the Sanctuary is we look at the whole person, because our issues live in every aspect of our being. They're not just in my conscious mind. I go to a therapist and I can say, okay, well now I understand this, and maybe my family XYZ problem I think I have, but that's not really what's driving my behavior. I went to treatment many, many times, and I was a model patient. And I would go right back to my drug of choice until I finally was able to, through a process that we have pioneered, to finally resolve it. And I have to say, in 20 years, I've been given opiates as a prescription for operations and so forth, and I don't even think about abusing them. You know, they make me itch, and I have the other side effects of opiates. And so I can honestly say that I'm free from opiate addiction, and we can help you get there too.